tips for relieving the pain of braces. People believe that braces are extremely painful, but the truth is that they don't cause much discomfort once you get used to them. Braces pain can be alleviated by following the orthodontist's instructions and using analgesics and ice packs. 1. Anesthetics for the mouth. Oral anesthetics like Orajel or Anbesol can be applied directly to the gums and teeth for quick pain relief during orthodontic treatment. Both a cotton ball and your finger can be used to apply it. Oral anesthetics numb your teeth and gums so that shifting teeth don't cause as much discomfort. 2. Pain relievers available over the counter. Taking an over-the-counter pain reliever is also an option. Take the medication an hour before your appointment if you know you will be uncomfortable after your orthodontic appointment. You'll experience less pain and discomfort as a result of this method. Be sure to read the medication's directions and to take it exactly as directed. If you continue to experience pain and discomfort after a few days of taking this medication, please contact us immediately. 3. An ice cube pack. Cold temperatures can lessen swelling and numb the mouth, making it easier to cope with the discomfort of a sore throat. It'll work great if you've got an ice pack on hand. In order to alleviate the discomfort caused by braces, simply place an ice pack on the outer side of your mouth. 4. A glass of ice-cold water. You can also use a glass of iced water if none of the above options are available to you. You'll be thirsty after your orthodontist appointment, so prepare an ice-cold beverage. This will provide some pain relief by numbing your mouth. Soft foods are 5th on the list. There are many limitations to what you can eat when wearing traditional wire braces. Hard candy, gum, and hard-to-chew foods should be avoided while wearing braces. For the first few days after getting your braces put on, and after each tightening, you may be better off limiting yourself to only crunchy foods. Stick to soft foods like soups, mashed potatoes, and cereal to avoid constipation. There will be an adjustment period with each new set of aligners, even if you go with Invisalign and don't have to worry about wire straightening. Be gentle with your mouth and eat softer foods while you're getting used to the new taste preferences. 6. Wax used in orthodontics. You'll probably be sent home with a packet of orthodontic wax. Protects the inside of your lips, cheeks, and gums from brackets on your braces with a special wax. The wax acts as a barrier to protect your mouth from the bracket's sharp edges. Use orthodontic wax according to the directions provided. To put it simply, you mold the wax over the irritating bracket. No need to be concerned about accidentally ingesting any because it is a non-toxic wax. Just remember to remove it before brushing your teeth. After brushing your teeth and eating, reapply the wax. 7. A gentle scrubbing with a mild detergent. A warm salt water rinse can also aid in the removal of toxins from the skin. Warm salt water gurgling can help heal any cuts or sores on your mouth and gums caused by your braces. 8. Massage of the gums. Massage your gums for pain relief if massaging a sore shoulder works. It's also a breeze to accomplish. All it takes is a circular rubbing motion with one of your fingers on your gums. Before massaging your gums, rub them with a block of ice. However, you should only do this for as long as it takes to reduce the swelling in your gums. 9. Maintaining good oral hygiene is essential. When it comes to pain and discomfort, how you care for your teeth and braces can have an impact. If you have braces on your teeth, the most important thing to remember is to keep them and your braces sparkling clean to prevent tooth decay and gum inflammation. You also need to thoroughly clean the brackets and wires because they will get clogged up with food. Use mouthwash and floss to remove any food particles that may have remained in your mouth after you eat. 10. Requires the ability to wait. A key piece of advice for coping with this transition is to be patient. Remind yourself of your ultimate goal, a more attractive and healthy smile. After a few days of pain and discomfort, you'll be able to enjoy your new smile.